Hello friends, welcome to the channel Dewdear Academy. In this video, I have included the question paper discussion, that is Sree Chitra Institute for Medical Science and Technology, SCT Staff Nurse Examination question paper. So here the first question is, now I am discussing the 21st question. I have already uploaded a video and it included the first 20 questions. Please watch it. So now I will be discussing the 21st question in this video, that is, a client after liver biopsy should be vigilantly observed for. Options are hemorrhage, dyspnea, vomiting, pain. Client after liver biopsy should be vigilantly observed for. So here the correct answer is option A, hemorrhage. So option A is the correct answer. After liver biopsy, the client should be vigilantly observed for hemorrhage. Then the 22nd question, the rationale for using normal saline to start blood transfusion is. Normal saline is commonly used as a primary IV solution. It is compatible with blood. Normal saline prevents hemolysis. Dextrose deactivates blood. The rationale for using normal saline to start blood transfusion. So here the correct answer is option C, that is normal saline prevents hemolysis. Normal saline prevents hemolysis. That is why the normal saline is used to start blood transfusion. Normal saline prevents hemolysis. Next question, question number 23. In case of blood transfusion reaction, the first nursing intervention would be. In case of blood transfusion reaction, the first nursing intervention would be. Options are notify the physician, stop transfusion, slow down the transfusion, administer antihistamines. In case of blood transfusion, the first nursing intervention should be option B is the correct answer. Stop transfusion. Option B is the correct answer. Stop transfusion is the answer. Now the question number 24. The priority nursing assessment in an immediate post-anesthesia client is to. Options are monitor vital signs, check gag reflex, assess pain, assess airway patency. The priority nursing assessment in an immediate post-anesthesia client is to. So the correct answer here is option D, that is assess the airway patency. It is the important or priority nursing assessment in an immediate post-anesthesia client. Assess the airway patency. Next question, question number 25. Alkylating chemotherapeutic agents used in cancer treatment act by damaging DNA in the cell nucleus, destroying messenger RNA, creating a hormonal imbalance, interrupting cellular metabolism. Alkylating chemotherapeutic agents used in cancer treatment act by. The correct answer is option A, that is by damaging DNA in the cell nucleus. Alkylating chemotherapeutic agents act by damaging DNA in the cell nucleus. Question number 26. The most informative measurement for determining cardiogenic shock is. Options are cardiac output, arterial blood pressure, oxygen saturation, central venous pressure. The most informative measurement for determining cardiogenic shock is. The correct answer is option A, cardiac output. The most informative measurement for determining the cardiogenic shock is by assessing the cardiac output. Measurement of the cardiac output. Next, question number 27. One of the important signs that nurse would observe in hypovolemic shock is. Options are hypertension, tachypnea, oliguria, cyanosis. One of the important signs that nurse would observe in hypovolemic shock. The correct answer is oliguria. Option C is the correct answer. Important sign that nurse would observe in hypovolemic shock is oliguria. Then next question. The normal pH of blood is. Question number 28. The normal pH of blood is. Options less than 7, 7 to 7.35, 7.35 to 7.45, less than 7.45. Correct answer is option C. 7.35 to 7.45 is the correct answer. The normal pH of blood is 7.35 to 7.45. The next question, normal serum potassium is 2.3 to 3.5 milliequivalents per liter, 3.5 to 5.3 milliequivalents per liter, 5.32 to 7.5 milliequivalents per liter, 7.5 to 8.9 milliequivalents per liter. The normal serum potassium level is. The correct answer here is option B, that is 3.5 to 5.3 milliequivalents per liter. 3.5 to 5.3 milliequivalents per liter is the normal serum potassium level. So option B is the correct answer here. Then question number 30. Normal serum creatinine is 0.5 to 1.5 milligram per deciliter, 1.5 to 3 milligram per deciliter, 3 to 5 milligram per deciliter, 5 to 8 milligram per deciliter. What is the normal serum creatinine level? So here the correct answer is option A, that is 0.5 to 1.5. So option A is the correct answer. 0.5 to 1.5 milligram per deciliter is the normal serum creatinine level. Option A is the correct answer. Normal serum creatinine level is 0.5 to 1.5 milligram per deciliter. Next question. Normal glomerular filtration rate in males. Normal GFR in male is. Options are 95 milliliter per minute, 110 milliliter per minute, 125 milliliter per minute, 150 milliliter per minute. Normal glomerular filtration rate in males. Normal GFR in males is option C is the correct answer, 125 ml per minute. Normal GFR is 125 ml per minute. Then question number 32. Normal serum albumin is 1.5 to 3 milligram per 100 ml, 3.5 to 5 milligram per 100 ml, 5 to 7.5 milligram per 100 ml, 7 to 10 milligram per 100 ml. Normal serum albumin is. So here the correct answer is 3.5 to 5 milligram per 100 ml. 3.5 to 5 milligram per 100 ml is the normal serum albumin level. 3.5 to 5 milligram per 100 ml is the correct answer for option for the question 32. Option B is the answer. Question number 33. A vaginal examination is indicated when membranes rupture spontaneously in a pregnant woman with polyhydramnios. 2. That is, a vaginal examination is indicated when membranes rupture spontaneously in a pregnant woman with polyhydramnios. So what is the purpose? It is to assess the fetal maturity, determine the stage of labor, note the position of the fetus, rule out cord prolapse. So here the correct answer is for option D is the correct answer, that is to rule out. Option D is the correct answer. So here the correct answer is option D, to rule out cord prolapse. So if the membranes rupture spontaneously in a pregnant woman with polyhydramnios, the vaginal examination is indicated to rule out cord prolapse. Then question number 34. Which one of the following is a major cause for atonic postpartum hemorrhage? Options are infection, retained products, systemic lupus, erythematosus, jaundice. Which one of the following is a major cause for atonic postpartum hemorrhage? Correct answer is option B, retained products. Retained products is a major cause for atonic postpartum hemorrhage. The next question number 35. Normal respiratory rate in a newborn. Now, what is the normal respiratory rate in a newborn? Options are less than 20 per minute, 20 to 40 breaths per minute, 40 to 60 breaths per minute, greater than 60 breaths per minute. What is the normal respiratory rate in a newborn? So here the correct answer 35, the correct answer is option C, that is 40 to 60 breaths per minute is the normal respiratory rate in a newborn. Normal respiratory rate in a newborn is 40 to 60 per minute, 40 to 60 breaths per minute. Next question number 36. The most accurate area to check the pulse rate in an infant is. The most accurate area to check pulse rate in an infant is. Options are carotid artery, brachial artery, temporal artery, apex of the heart. Carotid artery, brachial artery, temporal artery, apex of the heart. So in this question the correct answer is apex of the heart. The most accurate area to check the pulse rate in an infant is apex of the heart. Then question number 37. A staff nurse who was called by the nursing superintendent for a feedback on poor performance spent the remaining time of the shift blaming her supervisor and colleagues. The normal mechanism used by her is. Options are projection, reaction formation, rationalization, compensation. The staff nurse who was called by the nursing superintendent for a feedback on poor performance spent the remaining time of the shift blaming her supervisor and the colleagues. So here the mental mechanism used by that staff nurse is, answer is projection. Option A is the correct answer. Projection is the correct answer. Staff nurse is using the mental mechanism or defense mechanism projection because she is blaming others. In projection it means blaming others. So here the answer is projection. Then question number 38. Which one of the following drugs is a mood stabilizer? Options are Librium, lithium carbonate, tofranil, haloperidol. Which one of the following drugs is a mood stabilizer? Correct answer is option B. Lithium carbonate is a mood stabilizer. Lithium carbonate. Correct answer is option B. Lithium carbonate. Then question number 39. In the ECG recording of a client, the nurse observes tall peaked T waves, flat P waves, widened QRS complex and prolonged PR interval. The nurse identifies hypokalemia, hyperkalemia, hypocalcemia, hypercalcemia. In the ECG recording of a client, the nurse observes tall peaked T waves, flat P wave, widened QRS complex and prolonged PR interval. So what does this indicates? So here the answer is option B, that is hyperkalemia. So here the answer is option B, hyperkalemia. In the ECG recording of the client, if there is tall peaked T waves, widened QRS complex and flat P waves and prolonged PR interval, it indicates hyperkalemia. Then question number 40. The physician has prescribed 20 milliequivalents of KCl to a client. The available KCl is 10 milliequivalents per 5 ml. The nurse will administer. Options are 5 ml, 7.5 ml, 10 ml, 10.5 ml. So here the answer is option C is the correct answer, 10 ml. 10 ml is the correct answer. So thank you for watching this video. Hope you all liked this. I will be uploading the remaining questions in the upcoming videos. So please watch that also, and it will be useful for all those aspirants who are preparing for the various examinations and especially for SCT staff nurse examination. Okay, thank you.